Hello class, I am Dr. Caban. Today's presentation is on Chapter 7, beginning in your textbook on page 84. The topic is documentation of nursing care. In this presentation, I will bring to you content regarding documentation and also regarding charting. Let's get started. The first half of my presentation is on documentation. Upon completing your reading assignment of Chapter 7 as well as previewing my presentation, you'll gain the following knowledge. You'll learn to identify 3 purposes of documentation, correlate the nursing process with the process of documentation, discuss maintaining confidentiality and privacy of paper or electronic medical records, and also you'll be able to compare and contrast the 5 main methods of written documentation. You'll bring the following knowledge to the clinical practice setting. You'll be able to correctly make entries on a daily care flow sheet. So why do we need to document? What's the purpose of documentation? Well, I cannot express this enough. Documentation is critical in the nursing practice. Documentation provides a written record of the history, treatment, care, and response of the patient while under the care of a healthcare provider. It is a guide for reimbursement of costs of care that we provide as well. It may serve as evidence of care in a court of law. Documentation shows the use of the nursing process, and it also provides data for quality assurance studies. Documentation found in a patient's medical record is a legal record that can be used as evidence of events that occurred or treatment that was given. It contains observations by the nurse about the patient's condition, patient's care, and treatment delivered. It also can show progress towards expected outcomes. Our care plans, or also interdisciplinary care plans, provide frameworks for nursing documentation. Documenting in the medical record is organized by the nursing diagnosis or patient's problems. An initial assessment is recorded for each shift. Standard areas of assessments are usually noted on the flow sheet, and a note is added if an abnormality exists. Nursing diagnoses or problems are entered on the care plan, which is created soon after your patient is admitted to your facility. The plan is reviewed and updated every 24 hours. Implementation of each intervention is documented on a flow sheet or within the nursing notes. Evaluation statements placed in the patient's chart will indicate the progress the patient has made towards the expected goals and outcomes. The patient's medical record contains data about the patient's state in the facility. Only healthcare professionals directly caring for the patient or those involved in research or teaching should have access to the patient's chart. Patient information should not be discussed with anyone not directly involved in the patient's care. There are various types of methods for documentation: source-oriented charting, problem charting, focus charting, charting by exception, computer-assisted charting, as well as case management system charting. Whatever the method used, the nurse is required to chart the patient's progress periodically during the shift as defined by the organization. Let's review the various forms of documentation. We'll start talking about source-oriented and narrative charting. Source-oriented charting is documenting by source or author of documentation entry. Separate forms from nurses, physicians, dietitians, and other healthcare professionals to document assessment findings and plan the patient's care. This type of charting, also referred to as narrative charting, requires documentation of patient's care in a chronological order. What are some advantages regarding narrative charting? The advantage here is that this information is placed in the patient's chart in a chronological order. Documentation of the patient's baseline condition for each shift is provided in this type of charting. Source-oriented or narrative charting also indicates aspects of all steps of the nursing process. So what are some disadvantages? This type of charting documents all findings, makes it difficult to separate pertinent information from irrelevant information. Narrative charting requires extensive charting time by the staff. This type of charting also discourages physicians and other healthcare team members from reading all parts of the chart. Here is an example of source-oriented charting. Problem-oriented medical record charting, or your POMR. This type of charting focuses on patient status rather than on a medical or nursing care. There are 5 basic parts related to this type of charting: patient's data, problem list, plan, progress note, and discharge summary. An advantage with POMR charting is that this type of documentation will allow you to document care by focusing on the patient's problem, promotes problem-solving approach to care, improves continuity of care and communication by keeping relevant data all in one place, and it allows for easy auditing of patients' records in evaluating staff performances or quality of patient care. POMR requires constant evaluation and revision of care plan. It reinforces application of the nursing process. Some disadvantages with this type of charting is that it results in a loss of chronological charting. It is more difficult to track trends in a patient's status, and it also is data that is fragmented because more flow sheets are required. This type of charting hampers putting the pieces of the patient situation together and restricts seeing trends. Your pie charting. The P stands for problem identification. The I stands for intervention. And E stands for evaluation. Pie charting follows the nursing process and uses nursing diagnosis while placing the plan of care within the nurse's progress notes. Here is an example of pie charting: problem, intervention, and evaluation charting. Question 1. Monica, a nurse, is in the operating room. Monica knows that charting must be all of the following except for A. Subjective, B. Accurate, C. Brief, D. Complete. In charting, all of the following should be met except for subjective. Charting should be specific and definite. It should be in objective terms only, not subjective terms. Let's move on. Lesson 7.2, Charting. Upon completing this section of the presentation, as well as reading Chapter 7 in its entirety, you'll be able to compare and contrast the 5 main methods of written documentation. You'll be able to list the legal guidelines for recording on medical records and also relate the approved way to correct entries in medical records that were made in error. You'll bring the following knowledge to the clinical practice setting. You'll be able to demonstrate a systematic way of documenting that ensures all pertinent information has been included. You'll be able to document the characteristics of signs or symptoms in a sample documentation situation. You'll be able to apply the general documentation guidelines in the clinical practice setting, and also you'll be able to navigate electronic medical records and document care correctly. Focus charting is similar to your problem-oriented charting. It is directed at nursing diagnosis, patient problem, concern, sign, symptoms, or event. There are three components to this type of charting. D is your data, A is your action, and R is response. Or D as in data, A for action, or E for evaluation. The advantages associated with focus charting are as follows. It's compatible with the use of nursing process, and it is a shortened way of charting. Many flow sheets and checklists are used for this type of charting. Disadvantages are that the information or data is insufficient, patient problems are missed, it doesn't adhere to charting with the focus on nursing diagnosis and expected outcomes. Here is an example of focus charting. Charting by exception. It is based on the assumption that all standards of practice are carried out and met with a normal or expected response unless otherwise documented. It is a longhand note which is written only when the standardized statement on the form is not met. What are some advantages with charting by exception? Well, some charting by exception allows for highlights of abnormal data and patient trends. It decreases narrative charting time and also eliminates duplication of charting. Some disadvantages are that this type of charting requires detailed protocol and standards, requires staff to use unfamiliar methods of record keeping and recording, and also nurses who use this type of charting are not used to charting extensively, therefore certain charting information or important data may be omitted. Many healthcare organizations are moving towards utilizing computer-assisted charting. Electronic health records are computerized records of patients' history and care across all facilities and admissions. Computerized provider order entries provide efficient workflow and automatically routes orders to appropriate clinical areas. Computer-assisted charting is a very cost-efficient method of charting in terms of nursing time because information is entered from the patient's room, so no time need to spend trying to recall important details. Computer-assisted charting allows for documentation, which is done right at the bedside. Some produce flow sheets with nursing interventions and expected outcomes. There are many types of advantages related to computer-assisted charting. The date and time of the notations are automatically recorded. The notes are always legible and easy to read. Quick communication among departments about patient needs are communicated via computer-assisted charting. Many providers have access to patients' information at one time. This type of charting can reduce documentation time, provides for quick retrieval of electronic records. Reimbursements for services rendered is faster and complete, and it also can reduce errors. Disadvantages are as follows. Sophisticated security systems are needed to prevent unauthorized personnel from accessing patients' records. Initial costs are considerable. Implementation can take a long time. Significant cost and time to train staff to use the system is also associated with this type of charting. Computer downtime can create problems of input, access, and transfer of patient information. What is case management charting? Well, this is a method of organizing patient care through an episode of illness so clinical outcomes are achieved within an expected time frame and at a predictable cost, therefore managing the case. A clinical pathway or interdisciplinary care plan takes the place of the nursing care plan. Accuracy in documentation is critical. Be specific and definite in using words or phrases that convey the meaning you wish to express. Words that have ambiguous meanings and slang should not be used in charting. Documentation should be brief. Sentences are not necessary. You can omit articles and the word patient. Abbreviations, acronyms, symbols are acceptable. Choose which behaviors and observations are noteworthy. If writing is not legible, misperceptions can occur. Be sure to include as much information as needed in your documentation, so ensure that it is legible and complete. Remember, when you are charting, completeness is more important than brevity. See box 7-1 through 7-3 for documentation guidelines in your textbook. Now it's time to review some questions regarding section 7.2, charting. Madison, a pediatric nurse, prefers charting by exception. She realizes all of the following are true except for A. Charting by exception was developed in 2005 by a group of nurses at St. Luke's Medical Center in Sarasota, Florida. The goal is to decrease the lengthy narrative entries of traditional systems. Charting by exception is based on the assumption that all standards of practice are carried out. Or is it a long-handed note is written only when the standardized statement on the form is not met? The correct response here is A. Charting by exception was developed in the early 1970s by a group of nurses in Milwaukee, Wisconsin. The others are correct. Question number 3. Mrs. Smith, LPN, has just charted the following assessment on her patient. On February 14, 2008 at 3 p.m., the vital signs are stable. Patient voided 450 mL of clear, straw-colored urine. Patient denied pain, but appears tired. Amy Smith, LPN. Which of the following entries is incorrect? Is it the time of entry, the nurse stating an opinion, no line before her name, or is it all the above? Which entry is incorrect? The correct response here is D. The time of the entry should be in military time. As you see here, is noted in standard form. It says 3 o'clock p.m. instead of 1500. The nurse is stating an opinion by stating the patient appears tired. Charting should be based on facts and not opinion. There should be a line from the last word to the patient to the nurse's name. Question 4. And final question. Sally went into her patient's room to administer an antibiotic. Her patient states, I am not going to take another pill because they aren't working. What should Sally do? A. Leave the pill on the bedside table and come back in a few minutes. B. Throw the pill in the trash can. C. Circle the medication on the medication record. Give a reason for the refusal in the patient's progress notes and notify the physician. Or is it D? Crush up the medication in the patient's food and inform the charge nurse. Sally should C. Circle the medication on the medication record, give a reason for the refusal in the progress notes, and notify the physician. The end. This concludes my presentation on documentation of nursing care. Chapter 7. Remember that you are required to read the chapter in its entirety. Thank you.